Okay, I would ask that everybody here, if you have questions, interrupt me during this because I'm going to go fairly fast. I got about 20 slides. I might get through 3 of them or I might get through all 20 of them, but if you have questions. My point here is to, one, I was excited that you have such a thing for a couple things, or a couple reasons. One, there are a lot of markets who are getting into innovation fast and they're investing, they're coming together and they're in their nascency. Some have full-blown incubator communities. They have tech shops like in St. Louis has one that they're building. They have bio incubators. They work with academic medical centers and universities. My pitch to you is this, is if you can come together for this, come together as a community and start, because you're the 3rd largest manufacturer of engineers. That's the most important commodity out there. Any kind of STEM program, anything like that. If you don't tap into that, you're just wasting potential. You do have a big aerospace industry. There's a lot of crossover with any tech. And diversifying an economy makes sense. I don't have to tell you any of this. You probably are all here because of that. But the more you can come together to help spur innovation, as much as I say this, I used to be one of the young people, and I cringe now that I'm one of the old guys. And when you're around a bunch of 25-year-olds, like that young man who just presented, I want to be him again, and I'm not going to be that guy anymore. But that level of energy is infectious, and you got to tap into it. And if you've got, and it doesn't matter where in the country you are, I can tell you there are several communities that are burning out on the new company space. It's too expensive to do anything on the West Coast anymore. There's a lot of money. It's snobby money. It's too expensive to do anything in New York. You ever try to live in New York these days? Chicago is getting almost as bad. So you're seeing places like St. Louis, Nashville, Austin. You're seeing a lot of big companies like Google put in Google Fiber for a reason, because they see that as an innovation hub. There are things, if you come together as a city, as a state, as a region, and you tap multiple disciplines and come together, you have some interesting opportunities. So I'm going to go through this pretty quick. This is from a company called SG2 that kind of highlights there's this continuum of care. And if you look at this is pretty much a standard continuum out there. Healthcare is obviously undergoing a big transformation from going from fee to service to fee for value, which nobody really can define what that truly means, but it basically means we're going to go to a preventive framework as opposed to reactive. Makes sense, it'll cut cost over time, it works, but the infusion of digital capabilities is what's going to really matter. There are people in here who are doing virtual care and they're figuring out how to collapse the cost on it. I work a lot in this space. There's a lot of barriers to overcome, either the technology, the security, credentialing, licensing of clinicians, actually capacity of clinicians and so forth. But we're facing some macroeconomic pressures that are going to force this into existence, regardless of who's in the White House. So as you start seeing these things, the world's been focused around acute care in the hospitals. That's gonna end. And getting it into community-based care and seeing what you can do, there is a ton of opportunity in here. And if you aren't aware, if you're on the investment side, or who cares, if you want to look at the thing, look at something like Rock Health, and you can subscribe to their newsletter, and you can start seeing what kind of venture capital is out there, and it's crazy in terms of the intersection of healthcare and tech. Hard tech, soft tech, it really doesn't matter. Now, there's been a little bit of a bubble, but I can tell you on a $3 trillion spend, it's not going to end anytime soon. Every big company is getting into the space because it makes sense. Half of them will fail miserably. Some will do something really innovative. And then post-acute care, this is something people have to pay attention to in a very real way, because what is happening? The baby boomers are retiring, and you're seeing them live a lot longer. They're taking better care of themselves longer, and they're staying in their homes for a couple of reasons. One, it's expensive to go to nursing facilities, too expensive. And two, you probably have a better outcome if you're able to stay in your own place. So technology is allowing a lot of things, and I'll come back to this. So at the bottom, these are the things I spend a lot of time, and I'll go through a little bit of these, not everything. You'll see them come back and forth. Access is about getting people access to care. That seems very simple, right? Well, why is it such a problem in the United States? Transparency is a thing that every single industry in the world has gone through. You can figure out what a car is supposed to cost. You can find out what an airplane ticket, a hotel. But why can't you figure out what an MRI is supposed to cost? That's coming. Navigation, and I don't mean geographic. I'm talking about going through the health system. The health system as a whole is disastrous about this. Now, imagine Does anybody know a 53-year-old woman? Anybody? If you don't know a 53-year-old woman, you live in a cave. So there are these things, mammograms that you go to, right? Now, I don't know if you've ever experienced this, but when you have a negative finding on a mammogram, that's a scary, scary proposition. It could just be that there needs to be better imaging. You may have to do a thing called a needle oak and do a biopsy. You may have to go through a finding that there's cancer, and you have to deal with everything that goes along with that. The worst thing that you can possibly do is do a mammogram and wait 48 to 72 hours to find out what that is. You should be able to know that immediately, right? In any other industry, you would. There are still pockets in the United States where you have to wait a long time just because people aren't spending a lot of time thinking about it. We'll come back to that. Consumer entanglement. Does anybody know what that is? Anybody have an iPhone? How many people have an iPhone? Okay, if I took away your iPhone right now, what would you do? You are entangled. The thing's only been around for 8 years, but could you live without a smartphone? No, you could not. You would cry like babies if it were taken away. I know I would. Direct-to-consumer primary care. This is something that's real, and make sure, you're going to tell me when I'm out of time, right? I'm so going to violate that. So direct-to-consumer is about using technology at the appropriate times. And it is about getting access, whether it be virtual care. You can do it on the telephone. But there are some things, if you know you got bronchitis and you know you have the symptoms and somebody can talk you through a thing, there are a lot of technologies that just allow for that entire process to not include going into an actual physician's office. We'll come back to that. Specialty consults. This is the biggest problem. Specialists are deteriorating in numbers all across the place. How many clinicians in here are in administrative roles now? You sold out to the dark side. I'm part of the dark side, so it's okay. We're nice. It's a problem. And it's a problem worldwide, by the way. Internet of Things, everybody know what that is? It's connectivity of everything. It scares the crap out of me, quite frankly. However, it offers a lot of opportunity. And then there's this thing called artificial intelligence, which you probably have seen a lot of very heavyweight thinkers, Stephen Hawking. Everybody's weighing in on this right now. Do you know why? Does anybody know why all of a sudden people are talking about artificial intelligence? And it's not because of IBM Watson. It's because about 18 months ago, well, a little longer, some researchers out on the West Coast made some very significant breakthroughs in machine learning where they couldn't do a thing, they couldn't get past this wall, and then they just scanned in somewhere like 800,000 images of cats. And then they didn't give it any structure whatsoever, and they let a machine identify what a cat is. Now, when it fails because, you know, he's a raccoon and it's never seen a raccoon. But it actually learned through some complex algorithms. The bottom line is there's been more learning that's gone on in terms of machine learning and artificial intelligence in the last 18 months and the last 2 decades. That's why people are weighing in, because they see what's happening. So all these things people are, we're going to have to deliver in the healthcare ecosystem. Now, this mess, which I'm glad you can't read, is one of the things which says all these things which I have to worry about: mobile devices, wearables, DNA and pharmacogenomics. All these things are impacting the ecosystem. And Ascension is a very large health system that you never heard about. Via Christi is one of our affiliates. It's about 130 hospitals, I guess now. I've lost track. But we are basically a microcosm of the United States. So what we have to go through, almost everybody has to go through. So we're trying to get the pieces and parts and how they come together. And this was an attempt. Actually, this is the busiest slide I could possibly create to lose everybody. So I simplified it. These are the things that you have to focus on. And I talked about them. This little workflow fusion I'll come back to. But there's a digital destination that you want to get to. So I'm going to go through a couple of these pretty quickly. So access. One of the simple, stupid things in healthcare that is amazing that people don't do is they don't schedule stuff. You can schedule, is there anything that you can't schedule? You can schedule a veterinary appointment online. You can schedule, in fact, my dog gets better healthcare than I do. I work for a health system. We don't actually have a health system or a hospital in St. Louis, which is a problem. But it's amazing in terms of access, transparency. I know the price is going to be, I know all that. How come we can do that for dogs, but we can't do it for humans? We made it very, very complex is why. But this is one little company of many where there's a little bit of a problem. Getting into ERs takes a little while. So what if you could schedule a time when you're not so sick that you're bleeding or anything like that, but you're not going to go to urgent care. What if you could schedule during the downtime? It rationalizes when an ED is working or not working and has a little low in terms of volume, and it meets a consumer's expectations. Transparency. Now, this is a pilot that's going on right now in one of our markets, which has had some very interesting things. So if you look at it, there's a lot of components where you can say, this is what it costs. It knows your insurance, it can tell you what your deductible is going to be. It can tell you, okay, if you're self-pay, it's going to be this amount. And if you want to pay right now, it might be able to less. If you want to go in the middle of the night, it might be able to less. Depends. This is software that makes it easier. Anything that you can do in the healthcare ecosystem to take out the friction, increase transparency, is going to have a lot of benefit. And when you start seeing any of these younger people, there's this new standard in HTML called FIRE. Anybody know about this? Well, let me tell you what's going to happen over the next 4 or 5 years. Everybody in here, could write an app for mobility with the new standard. That's how simple this stuff is getting. So if you can think of a concept and you're afraid, well, I don't have the developer chops, I don't know how to go and write all this stuff, it's going to democratize how apps and other software is built. And it's more about, do you understand the process and you understand the data flow and what is out there? But don't forget about transparency, because there are a lot of businesses in here, whether you invest or whether you demo or you look at things, this is going to be key, because it's taking all the payer data, it's taking all your data, and eventually it's going to allow for nothing less than something like Kayak or Amazon, where you'll have reviews. Now, the interesting thing is, what's in healthcare, what counts as quality is a lot different between what a facility thinks and what a consumer thinks. As a consumer, you care about cleanliness, you care about a lot of things. Do you care about some esoteric measure that you don't even understand? No. You care about how fast you can get in. Navigation. So anybody seen anything called What to Expect or the Bump? You know these companies? So there's this company that owns something called the Bump, which helps you get, actually, they own a couple companies. They started with the Knot. Anybody heard this? Helps you plan weddings. Then there's the Nest. What do you think that does? And then there's the Bump. They're all tied. It's the best in terms of entanglement. It's very relevant, and having just gone through this, and I got to tell you, don't have your first kid at 45. It will kill you. I'm kidding. He's beautiful, he's wonderful, and I'm just never going to sleep for the next 5 years. But having this kind of thing where you engage with consumers on a very real-time basis every day, and you capture them and you give relevant information. This is the expectation. Any millennials in the room? Raise your hand. There's at least one. You guys are the good guys. You expect this, right? Any millennial is going to want to disagree. You expect instantaneous information. Well, it's the biggest group, and they're going to get it. This I talked about. You've seen this a lot. We've got some people in the room. This is one of those things that you want to facilitate, and the business models just have to be worked out. And it's just straight hospital to hospital, hospital to clinic, access to specialists. Now, eventually, it'll go straight to consumers. But this is the kind of stuff that is pretty typical. You don't need to go into a clinic anywhere to do so many things. I mean, doctors in the house. If somebody's got bronchitis, can you treat them on the phone? Yeah. Well, you can do this. You don't even need to see them, but and when you're really sick, some people don't want to be seen. Things like telepsychology, or telebehavioral, it's becoming a big deal because somebody doesn't have to leave anywhere. They don't have to go anywhere. Think about it. Somebody who's got a real serious behavioral condition that requires an hour a week of therapy or a couple hours intensive of therapy each week, why should they have to drive 30 minutes, wait, and then queue up, and then be in tears, have to go out to the parking lot, drive back? Does that sound like a smart move? When you can just be in your own house, you can recover faster. It makes sense. So anything on the direct-to-consumer, there are business models underneath all these, and it's more about capacity, how it interacts with the payer community, the physician community, and the provider community in general. There's things to be done. Now, with all this stuff, there's this thing about workflow. I'm going to talk about two kinds of workflow. there is a thing that's coming out. Does anybody use a bank or an airline where they get texted alerts for some reason? Or, okay, so we all do. That's personalized integration workflow. Have you noticed that some of it looks a lot more like a web page now and not just a text? You seen those? You will if you haven't, because now it's starting to gear things specifically to your needs. And they're real simple because you set up maybe you have a Fidelity account and you went in and you basically typed, I want alerts when the Dow Jones drops 500 points, or I want sell things, or you want to know when your flight is going to be late for whatever reason. They're getting better and better. Every industry is around that. So when you start seeing things like diabetes management and other conditions, there's a lot of this utilization that's happening. So you got to be thoughtful about, if you see some kid who wants to say, hey, we should do this for this workflow interaction, ask them if it's a consumer-based interaction, and how will it impact on the back end with the business. That's one element. Now, on the other element of workflow fusion, you're going to see this nice visualization. I mean, these are cool and everything. But this doctor up there might be a real doctor who is, is doing, say he's a cardiologist who's doing specialized in-person consults, and he's doing something on an iPad, and this happens. You have to make the workflow as seamless for an in-person visit as a virtual visit. And it's got to be super simple for a clinician. And if you've probably listened to the doctors today, most of the electronic health records are a disaster. And so what's happening? There are a bunch of companies that are popping up that there's a term called an overlay. And it sits and it makes life much easier. I just talked to one this morning that we're investing in. There are several of these out there that are coming. The large electronic health records are going to have the biggest problem because what they've done is, rather than democratize data flow, they've tried to hoard it and keep control. And that will be their undoing. So, tools and techniques along this. You've heard about things like IBM Watson, HealthKit. Google's got their little version of this. Samsung, even though they're aligned with Google, has their little version. But entanglement is about meeting a customer's needs at all points along the spectrum. And it's not just healthcare, but imagine a time where, for example, you are sitting at, it's 11:30. It's nice out. You're within, walking distance of 5 restaurants. But you don't think that way because you're busy and you're hectic. What if on your little iWatch or whatever wearable you have, there's an immediate suggestion that says, hey, based on everything we know about you, there are 5 things that you can walk to. You're going to get a caloric burn of X. You're going to, if you eat the following things, leave off the mayo on this thing, go into this thing, you're going to meet your health goals. If you get that little prompt, are you likely to use it? Well, yeah, you are actually. Gentle prompts work. Hard reminders don't. And with the iWatch and the other things, does anybody have the little alert that makes you get up and do movement after 45 minutes? Anybody got that? Yeah, that doesn't work on me, but it does work on a lot of people, and it's smart. So that level of sophistication is going to get more and more, especially with artificial intelligence, and it's going to be around activity and food management and food consumption. So, and how do you align with that? So any kind of entanglement strategies around consumers, because at the end of the day, if you're going to invest in anything, if it doesn't have a consumer push, you're either selling to enterprises or consumers. And if you're selling to enterprises, they're selling to consumers. You have to think about the consumer and the interaction with the consumer no matter what. And user interface, whether it be hard tech or soft tech, doesn't matter. You better think about that, because that is the difference between whether companies sell or not.